Thanks very much, Alex. Afternoon, everybody. To talk about everyone in, I think I have to sort of wind the clock back a little bit to the first mayoral election in Greater Manchester, because effectively we committed to it 3 years ahead of the rest of the country. I was on the hook, if you like, for having promised at that election to end rough sleeping in Greater Manchester. So, effectively an everyone in policy. I remember people at the time say, "Oh, what have you done there? It's going to be impossible." And I've always, in my political career, Alex, I used to hear people in the Labour years when we were in government saying, "Oh, under promise and over deliver," and I've never subscribed to that, because who gets inspired by an under promise? Who's going to buy into that? So when I kind of broke out of the Westminster system, I thought, well, no, the thing is to kind of give people what we could be if we all pulled together and we all tried to be what we should be. And that's where the commitment came from. I just thought the right thing to do at the start of devolution was to sort of aim really high and then get as far as you can towards that goal. So it was a risk, but it's the one that I've never for one day regretted. And I've been on a 4-year journey now with tackling rough sleeping and homelessness in Greater Manchester, and I feel I've learned so much. I can't tell you really how different my understanding is now to what it was 4 years ago, and I've never for one day regretted what we did. In advance of everyone in, we'd launched a scheme in Greater Manchester called A Bed Every Night, which again is an everyone in philosophy, and it was beginning to make real inroads pre-pandemic. We were beginning to bring down the numbers of people sleeping rough on the annual count, not where we wanted to be, but certainly making progress. And then when everyone in came, and we felt that was basically obviously national endorsement from what we wanted anyway. So we enthusiastically embraced it. 2,000, I'm going to give you the exact number, but roughly 2,000 people were offered self-contained accommodation in Greater Manchester, a single room accommodation, as part of the Everyone In programme. And while I do congratulate the government on it, it's not the case that it was fully funded and fully, kind of structured. We've paid quite a bit out of our own funds to support the Everyone In drive of the middle of last year, about £1.5 million. And, it could have been so different, actually, if the government had been really clear about the ongoing commitment to everyone in terms of what could be achieved. But nevertheless, a lot was achieved. Let me be fair about it. And I guess one of the things for today then, Alex, is to just sort of reflect, isn't it, and learn what lessons can we learn from what happened. Because actually what did happen was amazing, actually, in human terms. A lot of people used the change that came with everyone in to turn their lives around. Some incredible stories, some of which you can hear on a BBC podcast, The Homeless Hotel, that features a lot of our work. We were so lucky to have we'd already built a network of dedicated people and organisations, and I think we were in a position to move with everyone in because of the Greater Manchester Homelessness Action Network, which I set up, which is a partnership between housing associations, voluntary and community bodies, charities. It's an incredibly vibrant network, and it's become that. And it was really ready to sort of swing into action when we were asked to do so at the start of the pandemic. And I guess then to turn to the lessons. Well, the first is we can do it, can't we? We can bring everyone in. That's the first lesson. Why does it take a crisis to do it? In theory, it's easier in more normal times to bring everybody in. So shouldn't we be slightly ashamed that it takes a pandemic to bring everyone in? Why aren't we doing it in easier times when there isn't the same stress on the system? So we can do it is the first thing that I take from it. And then the second is, why was it particularly successful? It goes back to something I think you said, Alex, when I met with the faculty when we were looking at the partnership we want to build with you in Greater Manchester through the excellent work of Dr. Ruth Bromley, who's a prominent member of our homelessness programme board. I think I remember you saying that what changed with everyone in, and this was different from A Bed Every Night, was the dignity, actually, the message that a single room sends to people about, what the value and the respect that they should be given as every fellow citizens should be given. And sometimes the more, shelter provision, it doesn't reach those standards. But when you give people their dignity back and their respect and their privacy, that's when change happens. And I think you were really powerful on that point. And that's something we need to bear in mind here. Quality should be at the heart of homelessness provision. Quality. Stability. So, not a situation where people were in one place and then moved, that stability that was there in the program, I think, was tremendously important. And for me, that is the big lesson here. What we saw in Greater Manchester was also kind of radically different practice from our public services working with our voluntary community agencies almost overnight. And that we saw in the health service when it came to prescribing practice, but also in terms of the addiction support and services provided, different delivery in terms of the location of delivery, different work with regard to outreach and harm reduction. So public services in very short order, radically changing the way that they were working. And then from that, and it just phenomenally impressive network of voluntary community organizations providing the ongoing day-to-day support with necessities for people. So it was just incredible, actually, the whole infrastructure and the way that it kind of clicked into gear and what we saw. And I think then you kind of then have to reflect on why do we not achieve as much in normal times? And then this turns to some of the things that you were saying. See, my journey on this road has taught me that it is about quality and dignity that's at the heart of this. So when we stood up a bed every night, so bear in mind, this scheme didn't exist a few years ago, but tonight in Greater Manchester, 520 people will be supported across our 10 districts in COVID-safe bed every night provision. And pre-pandemic, this was largely shelter-based provision. But there was something important there, though, which was a bed every night was also the same bed every night, so that once people came into a bed every night, they weren't moved around. They could stay in the same settled place for as long as they needed to. And that was a real learning point for me, because I think that support has got to be about recovery, hasn't it? Giving people the breathing space to recover. That seems to me, the trauma of sleeping rough on our streets means that physical health will be fundamentally damaged by it, but so too, and perhaps more so, mental health. And therefore, the space to recover is what we should be thinking about more than just roofs over heads. And that is what matters, without the cliff edges of benefits coming in, or kind of the idea that you're kind of setting people up to hit another deadline, which might create another failure. So Bed Every Night, I think, has been successful because it didn't put those artificial deadlines on people. It provided accommodation for people with no recourse to public funds. Now that is if we're how can we have an everyone in policy and a no recourse to public funds policy? There's an inherent contradiction there, and I think that needs to be resolved. Our policy in Greater Manchester has we funded no recourse to public funds places through the Greater Manchester Mayor's charity, and we will continue to do that. But everyone in has got to mean everyone in, not some people we like in and others we want to push away to the margins. That can't be a basis for going forward. And I guess the principles that we've kind of built into Every Night are evident in our Housing First pilot that we've had running now for a couple of years. Again, it's about quality, dignity, but it's also about time and breathing space. So we've accommodated just over 200 people now in Greater Manchester on our Housing First programme. And it's amazing, actually, when you look at the results. I think people are surprised by the results. There's been an 89% success rate when it comes to people sustaining their tenancies, and a zero number of evictions. And the thing is, it's just simple, really, isn't it? If you start with people and respect the sort of inherent humanity and dignity, and provide a service that's right for that person, and you give them the ability to recover at their own speed rather than an artificial timetable dictated by the benefit system, people will recover, and people will be able to find their way back. And so many homelessness services in this country and the benefit system almost mitigate against that. They create pressure on people, and they create deadlines which create failure. And that, I think, is a big learning point from Housing First. So, Alex, I'll finish on this point, because in terms of the journey that Greater Manchester is on, we feel we've come a long way, but we're not yet where we need to be. And I'm actually going from this meeting now to a meeting of our homelessness programme board, where we are going to be looking at the draft of a homelessness prevention strategy for Greater Manchester, a 10-year strategy. And I think what we need to consider, both as a city region, but also to win the argument nationally, as I feel we did have an influence in what we did on homelessness, because it wasn't a national priority until 2017 when we started focusing on it. I think we've got to work towards a system now that puts housing first principles at the heart of the entire system, i.e., every person has to have the foundation of good housing behind them if they are to be able to do anything, really. And the pandemic has shown us that if you don't have good housing, you don't have good health. That is a fact. And I think, Housing First, as they do in Finland, should be mirrored here. That is to make it a national philosophy. Housing, I think, should be a fundamental, good housing, safe housing, affordable housing, should be a fundamental human right enshrined in UK law. For me, it's as critical as universal healthcare or education. You can't have a good life without it. And we've got to a point here where the market clearly doesn't provide for all people in all situations and create affordable options for them. And I think we need to follow the Finnish model, where we have a housing first mentality to the provision of all of our support. And I think if we had that, we would spend less money picking up the pieces with people pushed into crisis, in some ways wasting public money on crisis services. We would actually give people the foundations for success in their life and not need the intervention of various public services. And that, I think, is the argument that we should make. You could go further and say it should be a universal basic income, which also I think is an attractive argument. But I would start with housing and guarantee people's right to housing is what we should be talking about, because that's what the Housing First pilots in Liverpool, Birmingham and Manchester are showing. If you give people housing security, you give people the opportunity to recover and to go on to succeed. And my worry is we're going to go through all of this period and go back to the same old failed ways of doing things. Health is built in homes, in workplaces, in communities, or it's not built in those places. And the places that have the highest death rate from COVID are the places where people have the lowest paid, most insecure work, and then the poorest quality housing. Even before the pandemic in 2017, 21% of British adults said their housing was damaging their health. I would argue that was predominantly their mental health. I think it's the stress of insecure work combined with insecure tenancies that leads people to be living day to day, stressing day to day, worrying day to day about whether or not they're going to face eviction. That is not a sustainable place for this country to be. We need a programme of housing first enshrined across the country in all communities. That is levelling up. This debate about levelling up is starting to frustrate me. Levelling up is not scattering a bit of money for a train station here or there to favoured political places. Levelling up starts with need in our poorest communities, putting the foundations down beneath people, which are good homes and good jobs, and that is how people can turn things around. That is how, in the end, how we tackle homelessness in this country. I will leave it there, Alex. Conscious I've spoken for 15 minutes or so there, but I want to leave some time for questions, so I'll hand back to you.
I think that was a fantastic piece, Andy. Just bringing all those issues together for us.